With Genentech, most likely moving off the NASDAQ markets, and ImClone and Millennium, and a few other smaller ones, that's over $60 billion of biotech investment. Where do you think that money, first of all, where do you think that money is going to go?
So I think it's going to shift over into 4 different tranches. Obviously, it's going to be more so heavily weighted in the large caps. So there's 4 tranches. The first are the large caps. Genentech, when you get about $45 billion out of Genentech, you're going to get them somewhere in the, it's going to be allocated out into the large cap world. And then you have the second tranche would be mid caps that have marketed products that are profitable, because these are the companies, if you're looking at from a clinical risk, they have limited clinical risk. They do already have an approved product. It's already profitable, and we're talking about blockbuster drugs. Then you have companies that have marketed products but are on, basically they're couple years away from being profitable. That's the third tranche. And then the fourth tranche would actually be companies that already have phase 3 data. So you're removing the clinical risk, but obviously the risk there is the regulatory risk from the FDA. So I would say that money could be reallocated into those 4 tranches, but obviously more so in the large cap, because the biggest company, Genentech, is going out.
So you see more redistribution of biotech money to other biotech companies rather than people going to other sectors?
I think that this year, what we've seen is that money flow has gone into biotech, and this is the reason why is because we're seeing the large caps, actually the entire biotech sector maturing, and they're at a point where the large caps are now seen as kind of where the big pharma companies used to be about 5 to 10 years ago, and they were seen as a defensive play. And what we've seen now is that with the big pharma companies, we're seeing big, huge risks because of the patent expirations that are coming. So because of that, and they don't have pipelines that fill those lost revenue streams. So what you're getting basically is people are looking at the large cap biotech similarly as they saw the big pharma back 5 to 10 years ago. And so we're seeing the biotechs maturing, and so this year we're actually seeing the BTK outperforming all of the indices. It's outperforming the drug index, it's outperforming NASDAQ, the S&P 500, and that's because they're being seen as what big pharma was seen before.
More M&A also to be expected, including among biotech companies, to get critical mass?
I think that the M&A theme will continue. And the reason why is, as I mentioned, you're getting big pharma going through patent expirations. I mean, for example, Pfizer's Lipitor is going off patent in 2010. That drug alone represents about 25% of worldwide sales. Another example is Lilly's Zyprexa, which also represents about 25% of revenues. So you're getting these companies that are losing revenue streams. They have pipeline gaps. So that's one of the big drivers. The second is what we've also seen a trend is foreign companies buying into U.S. companies because of the currency, taking advantage of the currency effects right now. So those two are the big driving factors. So what we're seeing is that typically biotech M&A doesn't really happen as much as it's happened this year. And I think those are the two big driving forces.
So clearly the concluding message is that biotech is a great place to invest. Obviously, you need insights, and we thank you for your insights.
Thank you.
And don't forget to watch BioBusiness TV for more insight on the world of biotech.